Good morning. We're talking about kidney stones. Oh my goodness, what is it? And what causes kidney stones? What causes it? All right, so you're thinking to yourself, boy, I sure know someone that had kidney stones and or myself had kidney stones and they are excruciating pain. And let me tell you, there is no comfortable position that you can be in to feel comfortable when you're having kidney stones. So I'm going to go ahead and put my glasses on because I want to make sure I tell you all the information quickly and precisely. Here we go. What is an overview of kidney stones? This is from the Mayo Clinic, by the way. Okay, so as you can see here, they're deposits of minerals and salts. Remember last week we talked about pH. If your pH is too acidic, then your body will steal calcium phosphate from your skeletal system, and the byproducts that will be left over will be calcium. Your kidneys have to clear it out, and they become stones. There's other reasons for stones as well. But if you've had a urinary tract infection, you're increasing your chances of also getting stones. So I don't know if you can see, this is kind of small, but these are the kidneys, the ureters, and the bladder. We already went through that last week, remember? All right, so the symptoms. What are your symptoms? Severe pain in the side and back, especially like in the rib area. It radiates in the lower abdomen. It comes in waves. The pain is on urination as well. You can have pink, red, or brown urine, cloudy urine, smelly urine, just like in UTIs. You can have nausea and vomiting. You can have persistent, and actually not persistent, but just the urge to go pee a lot. Okay, fever, chills, and of course, a lot of pain. Okay. So let me just tell you, what are the causes? Actually, there's different causes. One could be the calcium, like we talked about, and the pH really affects that. The other thing that affects it is the dehydration. I want to just go over the different types of stones. Here we go. Kidney stones. You have calcium stones, like we said, calcium that's pulled out of your skeletal system. Okay, and when you're taking the wrong calcium, it could also precipitate in your blood. And if you don't have the right vitamin D, then what's going to happen is you're going to form stones because your body can't get rid of it. All right, the next type of stone is struvite stones. And these are a response of infection. Okay, then you have uric acid stones. And these are because maybe you're dehydrated or you have a high protein diet, or if you have an autoimmune disease called gout, and certain conditions will cause that inflammation. Okay, and then the cystine stones, and that's usually hereditary. Risk factors: familial, dehydration, certain diets like high protein diets, don't eat too much meat. Okay, if you're overweight, if you have problems with digestion, if you've had your gallbladder taken out, and other medical conditions like renal disease and all sorts of ureter problems. All right, there you go. I tried to make my video really short this time because I wanted to make sure I didn't bore you. But remember, you can check your urine with my UTI strips, and that will measure leukocytes and nitrites, and that will be indicative of an infection. And of course, my pH strips will monitor your pH in your urine. If you did get the UTI strips, though, there's an aspect there where it measures the acidity. But if all you wanted to do is just check your acid in your urine first thing in the morning, then just order the pH strips. All right, that's it. See you next time.